All right. Thank you all for being here. This is session 4, last session of these upcoming changes, Q&A sessions and information sessions. So we're glad you're here. We have done, this is our second sort of series of these. So we did one in the end of March, beginning of April, and then we've done them for 4 weeks. This is our 4th week in June too that we're doing these as well. Our plan is to keep doing these quarterly or until people stop needing them, whichever comes sooner. So this is our last one for June, but we may come back in July, August, September or so to do another round, depending on what things look like at that point in time. So let's go ahead and keep going. I always like to start with an overview of who we are, why we're here doing this. My name is Megan Bowser. I'm the Executive Director for Family Voices Colorado, and also a mom of 4, 2 of whom have disabilities and are on Medicaid waivers. Family Voices is a nonprofit that is staffed solely by parents of children and adults with disabilities, running a really wide range of diagnoses and ages. We all have some of that lived experience. We provide free help to families, so we never charge families for any of the services or assistance we provide. And that assistance looks like things like this, so education and training, webinars. We do monthly webinars. We're doing these series. We try to get good information out there as much as possible so people are informed and educated and know what's going on, because there's a lot to know. And then we also do advocacy and policy, so where we sit in all these meetings with Medicaid and go to the Capitol and just sort of making sure the voice of the families impacted by disability of any way, shape, or form in the state are well represented in those policy discussions. But the kind of main thing that we spend most of our time and efforts doing is the system navigation, which really is one-on-one help to families, to parents, caregivers, individuals, navigating through these crazy systems, particularly Medicaid and healthcare, but also community programs, not as much with schools because there's other great organizations that really focus on that. But we'll do pretty much anything else. And if it's not what is within our scope of expertise, we can connect you with somebody who it is. So that one-on-one work with who we call our family navigators. And I always just like to throw out, we are affiliate of some national organizations. So if you are in another state, are considering moving to another state, or have a friend in another state, that there is a Family Voices affiliate, an organization like ours in almost every state. So that can provide some similar sort of assistance. All right. Those of you who have been in presentations with me before know sticking to timelines is not my forte, but I will do my best to meet these timelines. So just quick introduction. We'll do some presentation. I've got some slides, and then I want to leave sufficient time for questions at the end, because there's all the information, but parsing through that to figure out what most applies to your situation can be challenging still. And so I want to make sure we can answer those questions too and get into any deeper in the weeds that is needed. Couple things I just ask: if you can keep yourself muted if you're not actively commenting or asking a question, so we don't hear your dog barking in the background and whatever else. When we get a fair amount of people on a call, it gets real noisy when people forget to mute themselves. So that's appreciated. And then today we're focusing on this youth and adults that are on intellectual or developmental disability waivers. So that would be the SLS waiver or the DD waiver, or youth that are on like the CES Children's Extensive Services or the CHIRP Children's Residential Habilitation Program waiver, that are getting close to transitioning into that adulthood window. I'm happy to answer questions from other people as we have time and talk about other programs as well. So if that's not you, you don't need to leave. We're happy to have you here and answer questions, but that's sort of who our focus population is today. Then I'm recording the slide deck portion of this. We'll stop it and do Q&A towards the end. That it will not be recorded, so you don't have to worry about your private information on the recording. So if you've got questions that start with things like, my child who is such and such age and has such and such diagnosis, save those towards the end because we want to be able to post these recordings on our YouTube channel without violating HIPAA and your privacy and all of those things. So feel free to ask more general questions throughout. Absolutely welcome that, but keep more individual questions towards the end, please. And then I'm presenting on what I know to be true right now. It is June 30th, so a lot of these programs launch officially tomorrow, but things change regularly and somewhat frequently in this world. So um, I'm presenting you what I know to be true today. It could change this afternoon or tomorrow, and if it does, we will do our best to keep you updated as to that. And then my last is don't shoot the messenger. These aren't my programs. I don't work for Medicaid. I did not develop these programs, but I think it's super important for you guys as professionals and as parents and as individuals to have as good of information as possible about what's happening. So they're not my programs, but I'm trying to make sure you've got info and details about them. So some of them I think are awesome. Some of them I think are make me nervous and all of the above. And some I think are awesome, but change is hard. So it still makes me kind of nervous. So there's a wide gamut in there, but these just I am the messenger. These are not my programs. So, all right, let's get started. Oh, and also feel free to put comments in the chat, questions in the chat, or raise your hand to ask them as well. A couple of our other Family Voices staff are on and are kind of watching the chat here too. If I try to watch the chat while I talk, I get real distracted. But I'm happy to answer any of those questions, and we'll stay on to make sure your questions get answered as we get through. All right. So, HCPF, or Healthcare Policy and Financing. This is the entity at the state that manages Medicaid for Colorado. So they have deemed these projects their priority projects. So all of these sort of different changes that are coming down the pipeline, most of which launch July 1st, are these priority projects. And we'll talk about the ones that are most applicable to this population today, but you can click the link if you've got the slides and read about all of them to your heart's content. There's lots of info on their website as well. All right. The biggest one of these changes, the one that most of these things sort of hinge off of, though, is this community first choice. So I want to spend time talking about that, and then we'll talk about some of the other changes that are happening as well. All right. So community first choice. What is this? So when we talk about Medicaid benefits, you'll often see the state will use this pyramid here where they talk about the different layers of benefits. So depending on how you get to Medicaid depends on how much of this pyramid you get access to. So if you're on income-based Medicaid only, you don't have any disability determinations, anything on file, just purely based on income, you get access to the bottom of this pyramid, the purple part of this pyramid. If you're on a Medicaid waiver, though, you get access to this whole pyramid and those waiver specific benefits, things like respite and home modifications and supported employment, all live in the green part of that pyramid. So you have to be on a very specific waiver to access those specific services. Community first choice is taking some of the things that are in some waivers, but not all, and moving them to be part of the purple part of this pyramid. And what that means is it doesn't matter how you get to Medicaid, you can access those services if you can justify that they're necessary. So that means you could be on Medicaid because you get SSI and have no other involvement with anybody else and no waivers, and you could still access these new community first choice services. Versus right now, you would have to be on a specific waiver to access specific services. This way, it won't matter. You can be on a waiver, you could be on any waiver, or you could not be on a waiver and still have access to the services as long as they're not duplicative of something else you have. So it's not the same as something they're already paying for, or as long as it's justified, right? You don't get physical therapy just because it's a benefit because you want it. You have to justify why you actually need physical therapy to access it. But it won't matter what way you get to Medicaid, you'll have the option to access these services. All right. There's a whole list of services that are moving. So if you're in a waiver right now that has these services, you'll still be able to access them. It'll just kind of move where their funding source comes from. And if you're on a waiver that doesn't have access to any of these would newly be available to you. So some of them, like home delivered meals, are great, not super highly used, but in some of these remote supports or systems, the like buttons to push to get some assistance are there. The big three are these top three: this personal care, homemaker, and health maintenance activities um, that are moving. One of the other changes with community first choice is they're instilling what they call this legally responsible person, and some new rules around them and some loosening of current rules that are for legally responsible persons. To note, a legally responsible person is a parent of a minor or a spouse of an adult, but it is not a parent of an adult. So these limits do not apply to you if you are a parent of somebody 18 or older. Currently, there's something called family caregiver that will apply to you if you're a parent of somebody 18 or older. The limits that apply to family caregivers are also going away. So a lot of those terminologies are going away. They're implementing this legally responsible person instead, which is just for minors and spouses. Okay. It's also expanding service delivery options. So right now, if you're on the EBD, Elderly Blind Disabled Waiver, you can do IHSS, so in-home support services. Okay. If you're on the SLS, Supported Living Services Waiver, you can do Consumer Directed Attendant Support Services, or CDOS. Under community first choice, on either of those waivers or none of those waivers, you could do either one of those programs, whichever one's the best fit for you. So it's expanding, so more options, more choices available to more people. Um, Another thing to note, that community first choice, or CFC, is not a Medicaid waiver in itself. It's not like the SLS waiver or the DD waiver or the EBD waiver. It is an addition to those. So you can be on SLS and community first choice, or you could be on the CES waiver and community first choice. You don't have to choose between the two. You can have both together. And most people that use community first choice will have both together. Not all, but most. All right. Versus, like, you can't be on the DD waiver and the SLS waiver at the same time. You have to choose one or the other. That's not the case with community first choice. All right. So who can participate in this? So anybody who's eligible can choose to. There are some services that will only be available through community first choice. So if you want those services, you have to use community first choice, but nobody's making you have those services. So, like, just like if you could qualify for physical therapy, doesn't mean you have to use it. Same thing with community first choice. You don't have to use it unless there's services you want that are only available in that area. So, to be eligible for community first choice, you need to be on a Medicaid waiver or not be on a waiver but still meet institutional level of care. So that really is a fancy way of saying they need help with your activities of daily living. So, and it doesn't have to be full physical assistance, but it has to be some significant prompting, behavioral support, cognitive support around feeding, bathing, dressing, toileting, mobility. So, not all those categories, but really two of those, or some really significant behavioral or cognitive support that you need. So, if you're totally independent, you're not going to qualify for community first choice. But if you need a lot of assistance with those day to day tasks, even if it's verbal response or supervision, then you can likely qualify for community first choice. And this program will be managed by the case management agency. So if you're on a waiver already, your case manager for your waiver will manage your community first choice as well. If you're not on a waiver, you'll need a case manager from the case management agency. All right, you'll notice I have on this first piece, though, any waiver except DD on here. The DD waiver, though, if you're on the DD waiver, you technically meet eligibility for community first choice. If you're using the residential, that daily rate on the DD waiver, that daily rate is intended to cover Pretty much everything that's available on Community First Choice. So DD is considered duplicative with Community First Choice. That means they're already paying you a set amount per day to do all of these things. So they're not going to pay you again for those same things through Community First Choice because they're saying they've already paid it through that daily rate. And so the DD waiver, if you're on the DD waiver using that residential daily rate, then you won't have access to Community First Choice because they're considering them overlapping or duplicative. All right. So when does this happen? If somebody's already on a waiver, it'll happen at your continued stay review or CSR, which is really when your new service plan starts every year for your waiver. So every year you meet with your case manager, you go through the 100.2 assessment, you talk about their service plan, and then there's a date, the first of some month, that your service plan starts for that new annual year. You do this every year. So if you're currently on a waiver, your CSR is that date your new service plan starts. So starting tomorrow, if your new service plan starts tomorrow, you can access Community First Choice as soon as you could get the paperwork done for it or beyond. So if you already had your renewal, you have to wait until you have that renewal again. If you're not on a waiver already, then Community First Choice can start really anytime you can get the paperwork done for it. So you could start the process today. It couldn't start services till tomorrow, but it's not going to happen. The paperwork's going to take 2 to 3 months probably. But you can start services as soon as that paperwork can get done and processed. All right. So what does this process look like? If you're on a waiver, you need to work with your case manager. If you're not on a waiver, you need to get a case manager. That's the first piece. And then that case manager is going to either do or refer you out to some assessments. So remember those top 3 services that are moving to Community First Choice were personal care, homemaker, and health maintenance activities. So the case manager will conduct what's called the Direct Care Services Calculator to determine the hours for personal care and homemaker. And then they will either complete the assessment for health maintenance activities too, if you're a July, August, or September renewal, or you're doing the process prior to October. Or if it's October or later, they'll refer out to this other entity called the Skilled Nurse Assessor that will do that assessment. And we'll talk more about the Skilled Nurse Assessor later. And that will determine how many hours they think are justified for those services. If you've been on these services before, you probably, if you've done CDOS or IHSS, you've done like the task worksheet. The Direct Care Services Calculator is really similar to that task worksheet. It's just kind of like a revamped version of that. All right. And then once all those assessments are done, everything's approved, then your case manager will help create a service plan for Community First Choice, just like they do for your waiver service plan too. So if you're on the SLS waiver, you might have a service plan that's got respite and it's got supported employment and it's got personal care and homemaker and health maintenance through Community First Choice, but it'll kind of all be done together by your case manager. All right. One of the things I wanted to give kind of a peek at, if I can get it to pull up correctly, is what this Direct Care Services Calculator looks like. And it's linked on the slide deck. So you have access to it too. And I recommend that you look at it before you meet with your case manager, before you start this process. So you kind of know what they're going to be asking you and what they're going to be looking at. So it's an Excel spreadsheet that's got all sorts of, this regular contact info in it. But then it also has these tasks. So it has tasks for homemaker, and then it has what's called norms. So these norms are suggestions for, on average, how long they think it takes to do that task or how much would be justified to put in for that task. If that's not enough time, your case manager should put more in. You just need to explain why that's not enough time. And that explanation shouldn't be, I work really slowly. That explanation should be, they need their bathroom really clean all the time because they're going to get on their hands and knees and crawl on the floor in their bathroom. So I need to make sure I clean it every day and sanitize it. Something related to the person's need and disability, why you're justifying that you need more than those norms. And the case manager should give you as much as is justified and needed for that. So they'll put, how long does it take? How often do you need to do it per week? And then this will calculate out. So if you said it takes 5 minutes and we do it twice a week, then it came out to 10 minutes per week. It also has this column for AME, which is called acquisition, maintenance, and enhancement. This is a new thing for some of these services. It's essentially teaching somebody to do those things. So if you're teaching them how to mop their floor, then they would mark yes for this. If you're just doing it for them, then you don't need to mark that. It doesn't really matter. It doesn't change the pay rate. It doesn't change the number of hours. It's just their documentation of when you're training versus when you're not. All right. So it goes through this for all of these homemaker tasks. There's 2 new homemaker tasks on here too. So if you've done homemaker before, these 2 on the bottom are new. So it's appointment management and money management. So if you spend 30 minutes a week managing their schedule of when are they at day program, when do they have physical therapy, when do they need to go see the neurologist again, then you can get paid under this homemaker. Somebody else could in theory do that for them and get paid um, under that for appointment management. And then same for money management. If you're helping them manage their money and their funding, then you can add that as a homemaker task as well. And then for personal care, it goes through the same thing. So all of these tasks, what's the norm, how much you do per day, whether you're training them to do it or not as well. There's a second tab on this worksheet that is task definitions. So it'll go through and explain what these things are. One thing to note is these are only supposed to be for that one person with a disability. So if you are cleaning the kitchen and there's 5 people that live in that house, only one of them you're doing homemaker for, this should really be only their portion of that cleaning task that you're doing. So if you're washing dishes after dinner, you're only getting paid for washing their dishes. You're not getting paid for washing everyone else's dishes. And that's really vague and not super well defined everywhere, but that's the conversation you should be having with the case manager when they go to fill this out. So this gives definitions. In the personal care section, though, it'll talk about these tasks, and then it has this section called what might make this task skilled. So when we're talking about someone's need for assistance with tasks, they're kind of figuring out what bucket does this fall in? So is this typical family responsibility or parental responsibility? Is this personal care? Or is this a skilled task? So something that would be done by a nurse or a CNA typically. And depending on where that falls, depends on how much support and funding they can get for assistance with that. So if they decide this is typical family or parental responsibility, then you're not going to get any time or help for that. This happens a lot with kids, right? If you're cleaning the bathroom that a 1-year-old uses, not that they're usually using a bathroom, but you're cleaning the bathroom for a 1-year-old, that's typical parental responsibility. I have yet to meet a 1-year-old who cleans their own bathroom. So that's not above and beyond. But if you're cleaning the bathroom of your 19-year-old, well, most 19-year-olds could clean their own bathroom, even if you had to fight with them. It still would be something they should be able to do for themselves. So then that would fall under this homemaker task. If we're talking about a more personal care, so like bathing, again, helping a 1-year-old bathe would be typical parental responsibility. Helping somebody bathe who just needs some assistance, maybe needs help getting the soap off thoroughly, or needs you to stand there and be like, nope, you need to put more soap. Nope, you need to wash your armpits. Nope, you need to rinse. Then that would be personal care. But then there's this whole section that makes it skilled. So it would be this paralysis, being combative, if they have a stoma, so if they have like a G tube or a trach, something like that, or this lack of communication, then those skills won't fall under personal care. They'll fall under skilled tasks, which pays at a significantly higher rate. So for all of these personal care tasks, they're trying to figure out where does this fall, and that determines where they'll put it on the sheet. So this is a super helpful section to read through these, especially what might make this skill or this task skilled. So on the calculator, your case manager will fill out this personal care section. And then if you're a July, August, or September renewal, or doing the process in those months, then the case manager will also fill out this health maintenance activities section, which is almost mirror image of this personal care with a couple extra things. But this is the skilled, and this does pay at a significantly higher rate if things are in the skilled area. If you are October or later, then these will be under the skilled nurse assessor will do this part of this assessment. All right. Let me get back to this. Okay, so that'll be a big piece that your case manager is doing for community first choice. Whew. Okay. Questions. I saw a few things pop up in the chat. Looked like not a ton, but are there questions that we should talk about in the chat here? Or any other questions that have come up thus far? I see about DD waiver that yes, if you're on DD waiver, then you can't do community first choice as things are right now. But it's probably worth it for you to listen and learn, because there are some people, definitely not all, but some that are on the DD waiver that may benefit from switching to the SLS waiver with these changes, that the SLS waiver becomes better, has fewer limits, may be a better option for some people as well. So, all right. Other questions? If you're on EBD waiver, yes. So the tasks that you're doing under EBD, if you're doing personal care, homemaker, health maintenance right now under EBD, those are moving to community first choice whenever you do your renewal. So not tomorrow, not moving for everybody tomorrow, but if you renew your waiver in November, then November 1st, those tasks will now be through community first choice instead of through the EBD waiver. If you, yes, you can stay on the DD waitlist while doing CFC. Yes. And the current rates, they're shifting some. So part of where the system existed before was personal care under one waiver paid at one rate, and under a different waiver paid at a different rate, and outside of a waiver paid at a different rate. So there was this real inconsistency between those. So they, through community first choice, they're lining all those rates up. So all those rates will now be the same across waivers. They're pretty close to what they were before. They're not hugely different, but there are some changes in those rates, and it's relatively the same. They also gave a like 1.6% raise overall, so it should come out to be pretty close, but there are some minor changes to those rates. Yeah. Other questions right now? All right. We'll keep going then. All right. One of the other things that is changing, particular to this adults with intellectual or developmental disabilities population, or particularly youth, yes, CFC has CDOS, is, see, I tell you, when I try to watch the chat, then I get all distracted. I don't multitask well. Good. Okay, so is those coming on to the DD or the SLS waiver? When you've done that process, and that process has happened in the past, it's followed this assessment called the SIS. So anybody who's newly getting onto those waivers has done this SIS assessment, the supports intensity scale, and they received a support level from 1 to 6. So based on those answers to those questions, they gave you this level, and that level determines the pay rate for some things. So the pay rate for community connector, the pay rate for other day programming stuff, it's determining how much that they get reimbursed. So if you're a level 1, it's much less. If you're a level 6, it's much more. So it's really gauging, right, that somebody who has a more minor, mild intellectual and developmental disability could maybe have one adult with 4 people. And so they don't need quite as much funding as somebody who's got more significant needs, who needs a one-on-one person all the time or two-on-one person all the time. And so the support level is supposed to identify that. Instead of using the SIS, that's switching to this new assessment called the ISLA, or the Interim Support Level Assessment. So it'll still come out with a level the same way the SIS did. It's just a new assessment instead of the SIS. This new assessment, here's just like a screenshot from it. I don't think the full assessment is publicly available, but here is kind of generally what it looks like. So it talks through these activities of daily living. It also has a tab for medical needs. It has a tab for behavioral needs. It has several tabs for different supports or different areas of need. And for each of these, they look at these questions, and then there's this drop down that pops up. You can kind of see here. So, for this task, are they independent? What level of support do they need? Are they totally dependent? Where's their support? And then you pick those answers. And it goes through all sorts of questions. I will say it is much more intuitive than the SIS assessment. It's as a family member, it's much easier to answer. Like, for walking, are they independent? Are they totally dependent? How do they move? Where does that fall? That's much easier to answer than, like, if they were going to take a college course, how much support would they need and how much time would it take? Because that feels so like arbitrary. So those are the kind of questions the SIS was asking versus this is more what's their level of independence? What's their level of support needs in these different areas? So it should in theory be easier. Okay. So the states contract with, so the SIS is this outside assessment that was created by this third party entity. It's used in multiple states across the country. We don't own it. Colorado is contracting with them to be able to use the SIS. And they've stopped that contract and created a new assessment called the Colorado Single Assessment. Eventually, the Colorado Single Assessment will be used for everybody on a somewhat regular basis, or shorter or longer versions of that, but we're not there yet. So, in the interim, we still need some way to assess the support levels for new people going on to the SLS and new people going on to the DD waiver. And so the ISLA is going to fill that gap. So it's going to do essentially exactly what the SIS has been doing, for anybody new coming on. We don't know quite how long the ISLA will be used for, probably a couple years at least, but we will see how things all play out. All right. So, big piece is the ISLA is only for those who are newly enrolling on one of these waivers. If you have already done the SIS and you already have a support level, you should never need to do the ISLA. Doesn't apply to you. It's just for those that are newly coming on. So if you already have a support level, that support level stays with you and always has. You only did the SIS once either, and that support level you got from that stayed. Same thing for the ISLA. You do it once when you're first getting onto those waivers, and then you keep that support level unless your needs significantly change. So all new DD waiver enrollees need to do this support level, so need to do the ISLA. New SLS waiver enrollees need to do the ISLA if you're participating or want to use one of the services that has different pay rates for different levels. So not all of the services on the SLS waiver follow this pay rate where it's like a level 1 gets paid at this rate, a level 2 gets reimbursed at a different rate. Not all the SLS services follow that. So if you want to use one of those services that does follow that model, then you need to do the ISLA. And this is done by somebody who works for the case management agency or who's contracted with the case management agency. So each one has at least 2 people that are doing it, but I think they said there was something like 94 of them in the state. So there's quite a few people that have been trained to do the ISLA at this point. So when and how does this look? So starting July 1st, Anybody who's newly coming on or newly needing to be assessed for the SLS or the D waivers, who falls in those categories on the previous slide, will do this ISLA assessment. If you are turning 18 in whatever September and you already did your SIS assessment, then you don't need to do the ISLA. You're good to go. You don't have to do anything else. But if you've not had a SIS and you need to get on one of those waivers starting in July, then you will need to do the ISLA. Right now, if you don't agree with your SIS level or your needs have changed and your SIS needs, your support level needs have changed, you don't get a new, they don't do the SIS again. You go through a process called the support level review. So it's a separate process. The case manager sends in this form and some justification for why their support level doesn't meet their needs and why they're requesting it to be changed to a different level. That process is not changing. So if you don't like your SIS level and you need to change it, you do the support level review. If you don't like your ISLA level and you need to change it, you also need to do the support level review. So that part of the process is not changing. All right. Other questions on the ISLA? Saw a few things pop in the chat, but I think people are answering it too. Yes, if you've already done the SIS, you cannot request to go back and do the ISLA. So you can just do that service level review process. All right. Keep going. I know it's a lot of info. One of the other things that's changing with this is called the skilled nurse assessor. So we talked about community first choice, and then there's these how are you assessed for services sort of piece. So we talked about that direct care services calculator. That's really intended for what they call unskilled services. So things where you need support, but it doesn't need the support of a CNA or a nurse. It could be the support of really anybody who's competent at following instructions to provide that support. So, if you need skilled support, however, that is going to fall under the skilled nurse assessor program coming soon. So, right now, if you use home health or private duty nursing, your home health care agency sends a nurse out who does an assessment, who decides how many hours they think are justified. And then they have to request permission from Medicaid for approval for those. But the home health care agency is who's assessing for services. If you use health maintenance activities, so either IHSS or CDOS through your waiver right now, your case manager is responsible for determining those hours for how many health maintenance activity hours you would need. And these CNA nursing level health maintenance are really talking about those same skills. It's just a matter of where you receive them, how they named, but it's how they're named. But it still is really that nursing and CNA level support that you need. So on that direct care, the things that fill in what makes this test skilled, those sort of support needs. If you're doing IHSS right now, your home health care agency probably helps a lot with this health maintenance activities evaluation, but it's not really their responsibility. And going forward, their ability to help with that is going to be more limited because the state is using this skilled nurse assessor to do that. So the skilled nurse assessor is going to replace both of these models, and it'll be one assessment for all of these needs, no matter whether you choose to have a home health CNA provide them or you choose to use IHSS or CDOS. It'll be one assessment for any of those service needs. And, there's lots of whys to this. The home health care agencies sometimes only provide a few services, and so they're not necessarily talking about or evaluating for all the services. So let's say a home health care agency only provides CNA, but your person actually has some like private duty nursing level needs, things that are beyond what a CNA can do. If that home care agency doesn't provide private duty nursing, they're not going to evaluate you for it. That's not good business to evaluate somebody for something you can't provide them. And so in theory, this provides a more comprehensive evaluation that covers all the services, that is not done by the home health care agency. It's done by this third party entity. Take it. Yeah. I'll leave it at that. That's the intent. Okay. So who needs it? Anybody who needs skilled, or every time you hear skilled, think more medical care needs. So this is somebody who, um, not that they just like can't be left alone, they need constant supervision. That's not skilled care, but that they need somebody to be providing medical care for them. And that could be dressing when they have splints or braces or abnormal muscle tone. That could be giving medications. That could be managing a ventilator. That could be managing G tube feeds. It can cover kind of a wide range, but it's this skilled category. So if your person needs skilled care, eventually they will need to go through this nurse assessor process. Anybody can refer to for this nurse assessor. So they've said the parents can, the doctors can, the case managers can, your home health care agency can. So there's a wide range of people that can submit to get this assessment, to submit a referral to get the assessment started. And then the assessment is done by a nurse who's employed by this company called Telegen. So Telegen currently is contracted by Colorado to do some other things on waiver renewals and stuff. They're going to phase out on a lot of that work they're doing and start doing this nurse assessor instead. So it's a nurse who is employed by them, and then Medicaid pays Telegen. So contractor. Ooh. So this is starting, it was July 1st, now it's August 1st. So starting August 1st of this year, the nurse assessor will start doing these assessments. So referrals should be submitted ahead of time. So all of these things, you need to be prepared ahead of time in order to have everything done, all your ducks in a row before services are actually supposed to start. So we're saying for this, like 45 to 60 days ahead of time. So this could be before your waiver renewal is due. So if your waiver renewal is coming up and you use health maintenance activities right now, you would need the skilled nurse assessor done before that. Or if you have private duty nursing or you have CNA, you have long-term home health right now, then you should, if you're an adult, have a PAR, prior authorization, that has some expiration date of when it's due again to be renewed, where the state said, yes, you can have this service up until such and such date. And then you have to ask again. So you would need the same assessment in order to do that PAR renewal as well. So for one of those two events. The timeline is supposed to be from the time somebody puts in a referral to have this assessment done. They've got 7 business days to both do the assessment and give you the report about what that assessment concluded. So their recommendation report. So that's a tight turnaround for them to have to follow. Please, please let it be true. We will see what it looks like when the referrals actually go in, but we hope they'll be able to meet that timeline. July, August, and September renewals will not do this process this year, though. You get an extra year, so not till 2026 will you need to do this process because it's just not ready yet. So if you're a July, August, or September renewal, then your home health care agency is in charge of this, or your case manager is in charge of doing the evaluations. You can still access all the services. You just won't be assessed by the nurse assessor until next year, but everything else still keeps going. All right, so referral is sent. They schedule the assessment. The assessment can either be in person or virtually. You should have some say in that to request one or the other. We're not totally sure what that's all going to look like yet. Hopefully, sooner than later, we'll know. You can provide additional documentation. So if you have like care plans from your home health agency that show what you've already been doing, or you have a great after visit summary from the doctor you just saw that outlined all of their medical needs, those are great things to provide to the nurse, but you don't have to provide any of those. They're really writing this recommendation based on your ability to articulate what the needs are, or whoever you bring with you's ability to articulate those needs. So you can bring extra documentation if you think it'll be helpful. I recommend it. It never hurts to have paperwork that justifies what you're saying to be true. You can also ask other people to join you for this assessment. So if you have a home health care agency, you could ask them to come to this meeting. They don't get to run it, but they can at least come and support you. Or you could ask your case manager, or you could ask your mom, or you could ask your nurse that already comes to your house. Whatever it is, anybody who you think might be helpful to be there, you're welcome to invite them to this assessment meeting. And then the nurse is going to go through this new tool the state created called the Skilled Care Acuity Tool to determine how many hours they think are justified. And then if they look at that and say, "Ooh, you thought bathing would fall in here. I don't think bathing is skilled. I think bathing is just personal care." Then they'll go through that direct care services calculator and fill in some of those things as well to make sure that when we're talking about bathing, we're addressing the need, even if they don't think the need is skilled, that we're not just leaving it out where it's not getting covered at all. And then they should talk about the different options. So whether you wanted to do home health and private duty nursing, or you wanted to do health maintenance activities through either of these models as well. And then they'll make a recommendation report, and they're going to have this online portal that you can access that report in as a family, and their case manager should be able to access that as well. And then you can use it as you wish. You only have to do this assessment once per year. So once you've had it done in a year, you don't have to do it again until the following year. It should travel with you, even if you decide to switch how you're getting services. So let's say right now you're like, I'm sticking with CNA. That's working really well for us. And then come November, you're like, you know what? Forget it. I want to do CDOS. I think that's going to be a better option. You don't have to do another skilled nurse assessor report. You can use the same one unless your needs have changed significantly, and then you can request one sooner. All right. Other miscellaneous changes that are happening in these processes too is some of the caps that are currently in place. Oops, there's a typo there. Not CAO, it should be CAP. Are changing. So right now they're going to institute this new 16-hour per day cap for individual caregivers. So this doesn't apply to the DD residential rate because that's not like a per hour thing that you're billing. It's like one rate for an entire day. But for any service that you're billing per hour, you're going to be capped at 16 hours per day that any one person can bill, whether that person's a parent or a total stranger, a nurse, a personal care provider, doesn't matter. They can only be paid by Medicaid for working 16 hours in any given calendar day. It's more like labor law sort of things. They want people to sleep for 8 hours. Whether you do or not is a whole different deal in the reality we live in. But that's a new cap that's being put in place. And that's also for any number of people. So let's say you have 3 kiddos in your house that all qualify for 8 hours per day of CNA services. You can't, as one person, provide all of those services. It would need to be multiple people that provided that. Or if you have one person who qualifies for 23 hours a day of services, they can qualify for 23 hours, but it has to be split between at least 2 people providing that care because one person can't clock for more than 16 hours in any given day. Is a new rule. One of the old rules, though, was that a family member, so a family caregiver, could only, oh, yeah, I butchered this line, could only work 40 hours per week. So this should say removal of 40-hour per week cap, not per day cow, per week cap for caregivers. So right now, if you're doing personal care for your adult who's on the SLS waiver, you're only allowed to do 40 hours per week of personal care. And if they qualify for more, somebody else would have to provide those additional hours. That is going away. So as a parent of an adult, you can do as many hours as they need as long as you don't go over 16 hours in any given day. Those 2 new caps will go into place again at your renewal. So let's say your renewal isn't until March, and right now you're stuck doing 40 hours a week. You will stay stuck at only doing 40 hours a week until you do your renewal. And then at that renewal, you can increase to do more hours per week. Another big change that's happening for those on the SLS waiver, and one of the reasons the SLS waiver is going to become a better waiver, for lack of a better way to say it, for a lot of people, is the service plan authorization limit, or the SPAL, is going away. So right now on the SLS waiver, also based on your support level, so the SIS assessment gave you a certain level, and that level determined your SPAL, or what the kind of budget cap for your waiver for the whole year is. And they're pretty limiting, which made it hard to use all the services on the SLS waiver because you ran into your annual budget cap. With community first choice, that budget cap goes away. So you can use as many SLS services as you need and as are justified, as long as you don't go over. Some of the individual services have their own caps still. So like day habilitation has a certain number of units cap, but that's all that there will be for limits. You're not stuck under this annual budget cap anymore. So your CDOS or your IHSS are not part of the waiver anymore, and they're not part of any specific caps, which will make it where way more people can get their service needs met on the SLS waiver. All right, questions on this? And I have a couple examples I can go through if that's helpful for anybody. It's going twice. All right, I'm going to go through a couple examples. We'll stop the recording and I'll answer any last questions that are left to do. All right, so here's one example. These are totally made up people, made up numbers, but I do my best. So Rosa is 24 years old. She has Down syndrome. She uses a CPAP. She lives with her mom in Arvada, and she's on the DD waiver, and her CIS level is 4. She has a September renewal. So September 1st, her new service plan starts. Right now, she's doing that residential. Her daily rate's around this $225 per day. She goes to day program. She does job coaching. All right, so the process for Rosa, she's got that September renewal, so 60 to 90 days before that, so June or July, she should have her annual waiver meeting with her case manager. They're going to redo the level of care like they do every year and talk about what waiver services she's using. And then come September 1st, her new waiver service plan will start. Because Rose is on the DD waiver, pretty much nothing needs to change if she stays on the DD waiver. Mom will continue to get the same daily rate. She can keep doing those programs that she's doing. That's it. Rosa could also decide to switch to the SLS waiver. And if she did, then she would need to do an application for that waiver. She would need to do the direct services calculator, the skilled care acuity tool. She'd need to develop her service plan for the SLS waiver. She would not need to do the ISLA because she already has a service level of 4, or a support level of 4. And then she could switch to the SLS waiver and do community first choice services on that. So she could do IHSS or CDOS on that instead of getting that daily rate. But then she would lose her daily rate, which for Rosa might not be a bad thing, depending on lots of factors for their family. But if Rosa's mom is 85 years old and is ready for Rosa and to move to a host home, for example, because she can't keep taking care of Rosa, then they might need to stay on the DD waiver because that host home is going to want that DD waiver daily rate, or that group home is going to want that DD waiver daily rate. But if Rosa's mom's young, they're happy, they've got a sibling that wants to take care of her when mom's not able to, they've got a whole setup in place, it might be to her advantage to switch to the SLS waiver. So that's a conversation that family would need to have based on lots of family dynamic situations, not just Rosa alone too. All right, another example. Let's have Frank. Frank is 17 and is turning 18 in September. So Frank has cerebral palsy and epilepsy. He's a wheelchair user, nonverbal, gets bullish YouTube feeds, and lives with both parents in Colorado Springs. And Frank is on the CHCBS waiver, Children's Home and Community-Based Services waiver, that doesn't renew until November. And he currently is doing IHSS, but health maintenance activities only, because that's all that's available for kids, and has 10 hours a day, and it's split between 2 parents. So Frank's process is a little more complicated because Frank is switching from children's services to adult services, and because Frank's not on the DD waiver and would have to sit on the waiting list for the DD waiver. So that's not an immediate option for him. So for Frank, When he's 17 and a half, they should have started talking about transition. So in June, he would do the new level of care and need to discuss the adult waiver options. They would talk about community first choice. Oh, I don't think I put the ISLA on here too. So if he decides to go to the SLS waiver, he would also need to do the ISLA and some part of this process as well. And he would need to go to the skilled nurse assessor as well. And then once they've done all these assessments, then they could talk with the case manager about what they're choosing. And then in October, his new service plan would start. So the month after he turns 18. All right. So let's say for Frank, they did the assessment with the skilled nurse assessor, and it came out to 8 hours of CNA and 1 hour of intermittent nursing, or they could choose 9 hours of health maintenance activities. And then him and his case manager went through the direct care services calculator, and it came to 2 hours of personal care and 3 hours of homemaker per day. So Frank's probably going to go on the SLS waiver or maybe the EBD waiver, one of those, but he could sit on the waiting list for the DD waiver. So when he's choosing whichever waiver he chooses, then for those care needs, he would have to choose, does he want to go through an agency? Does he want to do IHSS, or does he want to do CDOS? So if he did IHSS, like they've been doing under a different waiver, his hours are going to increase to 14 hours a day, because previously he only got health maintenance activities, but now he can get personal care and homemaker as well. But it might pay around $20 an hour because those homemaker and personal care pay a little bit lower. But then he could add other services that are available on whichever waiver he chooses. If they switch to CDOS instead of being limited to a certain number of hours per day or per week, they're going to take all those assessments for all those hours and plug them into this monthly allocation worksheet that is going to boil all those hours down to a certain number of dollars. So a budget for the month instead of a number of hours. And there's a lot to CDOS, so I'm kind of just doing the overview right now. But let's say they calculated out this 14 hours per day really came out to be about 14,000 per month. It's coincidence that those are both 14. Some pay less, some services pay less, some services pay more, but they calculate it out. So then if they did that, either Frank would need to be able to manage his own care, or if Frank's not able to, then he needs an authorized representative. So somebody who's going to manage his care team for him who is not providing care. So the authorized representative cannot be paid for providing care as well. So let's say Frank's dad becomes his authorized representative. Then Frank's dad can decide who's going to provide however many hours of care and how much he's going to pay them for providing that care. And you could have more hours and pay them less per hour than you would have under IHSS, or you could have fewer hours and pay them more per hour as you would under IHSS. Another big thing about CDOS is you've cut out the middleman of the home healthcare agency, which means you lose the support the home healthcare agency provides, but you also gain the cut of the Medicaid funding that agency takes in order to cover their overhead costs. So a home healthcare agency takes what they get from Medicaid, and they take some of that to pay for their building and their insurance and their supervisors and their administrators, and then take what's left and pay that to the employees actually providing care. In CDOS, you've cut that portion out, so there's a lot less overhead costs there. So more of it goes to the actual people providing the individual care under CDOS. So then they could make the setup of who's providing care on what days, make a calendar that works for them for homemaker, for personal care, for the health maintenance, and decide how many hours. And then they can also get their waiver services there as well. All right. Questions. Maybe have more general questions that we should answer while we're recording still too. Go ahead.